Okay, this is going to be a little foundational series. So a series of movements aimed at people who are really struggling. Even the basic drills that I've done with you, I'll share it on here, they're hard. You're struggling to balance, you feel tight, you feel sore, maybe it's chronic pain, maybe it's something like fibromyalgia, maybe it's MS, maybe you're coming back from surgery, or it's just years and years of bad mechanics. And we need to just teach your nervous system that it's safe to let go of some of that tension. And we're going to start with very, very basic drills just to teach you how to. So this is the first one. We're going to start to learn how to shift our weight. So that's it. So think you can do this when you're brushing your teeth, you can do this when you're in the kitchen, when you've got a second. Seems a bit silly, but I use this with people who've maybe not walked for a long time, they've been bedbound, they're using a walker, they're used to that kind of shuffle, and they don't really know how to load those hips. You know, think of a toddler when they first stand up and they're like, you know, and they're learning how to load these hips, how to use these glutes. That's what we need to do. We need to, you know, we can throw stretches at it, we can do split squats, whatever, you know, whatever you've been advised, whatever you've tried. But we've got to rebuild that map from the beginning. If you're in a place where you're just so tense and tight that even the most basic of movements are really difficult and even painful, we have to start from the root. So we're going to learn how to shift our weight. So that's our first one, yeah? So we're going to start with that, shifting our weight, shifting our weight. When that feels good, we start to lift that leg, yeah? And that's it. This is the first one. The one I want you to just start throwing in whenever you get a minute. Just look, I can even pull my hip up a little bit there, a little hip hike. If you're really struggling, it might just be here. Just that little bit. You might not even lift your feet up, you know, just a tiny bit. And once that rhythm is there, start to lift that foot. And gradually, this movement is going to build. Yeah? So we're going to get into it in the next one a bit more, how to advance that movement. This is your first one.